Okay, thank you everyone for being on time. It's 3 p.m. So we'll now officially start our webinar for today. So thank you everyone for being on time. Um, so today is a Friday. Hope everyone have a great week. So thank you for joining us today. So before I hand the time over to our wonderful speaker, maybe I would like to share with everyone the house rules. If you're here more than once, we will always share these house rules with you guys. Like, okay, so if you have any questions, do use the Q&A button in the black color bar at the bottom, and then type your questions there. Our speakers will actually address them at the end of the sharing segment. Okay, and then also we will have a feedback form at the end of the health talk. So do help us to fill in because we wish to do better in the future health talk. All right. So without further ado, I will now hand the time over to our speaker for today, Miss Sabrina O. She is the Assistant Nurse Clinician from TTSH Ward 5B. So she is here today to share on some discharge advisory for angioplasty and stenting, which is a very common procedure that for heart conditions like heart attack. So Sabrina, please.
Hi, thank you. Good afternoon, everyone. I'm Sabrina. Thank you for taking your time to join in this Zoom talk on discharge advice and coronary angioplasty and stent. My ward is a cardio ward, so we have received many cardio cases that patient went through this coronary angioplasty and stenting. With that, I would like to emphasize on the importance of this talk. According to the MOH Ministry of Health statistics from year 2019 to 2021, ischemic heart disease is the top 2 principal cause of death. This is pretty alarming, so I hope this talk would give you a clearer picture and information, and that everyone here can take home some meaningful message from this talk. You guys can even share to your family, friends, and even your neighbors. So for our objectives today is on what is coronary artery disease, acute myocardial infarct, and angioplasty. Secondly, we will talk about discharge advice to comply to. Thirdly, what are the risk factors of coronary artery disease? Lastly, the importance for a need to change our behavior, example, our lifestyle, diet, and exercise, to prevent another heart attack to occur. Coronary artery disease. So you all can see these 3 diagrams here. For the first top picture shows an heart artery supplying blood to the heart muscles. This is to keep the heart working like how your heart is beating. Basically, it is very important because this is how we survive. No heartbeat equals no life. Okay, so for the middle picture shows a yellow substance that is called fatty deposit. So how this fatty yellow thing comes by? So this is built up from what we eat. Example, fast food, oily food, convenience food. Okay, so when the fat, also known as plaque, builds up in the wall, it will narrow the coronary artery, slowing down blood flow to the heart muscles. Last diagram, you can see the plaque built up, blocking the artery wall. So with that, it can cause symptoms like chest or neck discomfort, breathlessness, irregular heart rhythm, and also feeling tired. And this comes to my next slide about acute myocardial infarct, AMI. In a layman term, you will know it as heart attack. Okay, so for a heart attack, from what I've explained from the last diagram, a heart attack can happen when blood clots block the narrowed artery completely, preventing blood flow to the heart muscle, causing heart muscle damage as shown in this diagram here. So we need to restore blood flow as soon as possible to lessen the damage to the heart. How do we do it? My next slide will explain that. Patient will need to go through coronary angioplasty, also known as percutaneous coronary intervention, PCI. It can help to increase blood supply to the heart. In the PCI procedure, this first photo shows a balloon fixed on a thin wire moving forward to the artery. Second photo is when the balloon inflates to compress the plaques against the artery wall. This widens the blocked artery and restore blood flow. Third picture shows the balloon catheter and stent. Stents are metal mesh tubes. Some stents are even coated with medication. Fourth one shows the stent deployed into the newly opened area of the artery. So after this procedure is done, with no complication, patient will be able to discharge within the next 2 to 5 days. Patient should be accompanied home and also advised not to drive home yourself. We need to look after the puncture site. So the puncture site is either at the wrist or groin area. We need to avoid lifting heavy objects and doing vigorous activities for at least 48 hours post-procedure. You may shower but avoid swimming until the puncture site is healed. Monitor the bleeding at the wrist or groin. If you notice any bleeding from the wrist, sit down and apply firm pressure with your fingers for at least 10 minutes or until the bleeding stops. For the groin side bleeding, you need to lie down and apply firm pressure for 10 minutes or until the bleeding stops. Avoid climbing stairs. When you need to sneeze or cough within the 48 hours post-procedure to apply pressure on the site. So after you discharge, you will need to monitor for signs of infection such as fever, redness, discharge, warm, itchiness, pain or swelling over the puncture site. Monitor for any breathlessness, palpitation, heart beating very fast, excessive sweating, tingling sensation or bruising. If bleeding continues even after applying pressure, please head to the nearest A&E. Please call 995 if you experience persistent chest pain even after taking the glyceryl-trinitrate medication. So for medication, post-procedure, your cardio doctors will prescribe medications like blood thinner, example aspirin, Plavix, Teglarol. Please make sure to take it as these medications will reduce the risk of blood clot formation and blocking the stent. You must not stop the medication without consulting your cardio doctors. Also, please do not replace prescribed medication with traditional Chinese medicine, which is our TCM. Subsequently, you may go back to work. You may resume to work after 1 to 2 weeks or advised by your cardio doctors. We also strongly recommend you to participate in the Tan Tock Seng Cardiac Rehabilitation Program. It is a holistic program that aims to help you return to your usual routine and also back to work. We recommend you to do light activities after 48 hours to 72 hours of rest with no visible bleeding or swelling seen over the puncture site. Over the 2 weeks, your activities should gradually increase from light to moderate. Please avoid lifting heavy objects more than 5 kg as well. So it is normal to feel emotionally down after a heart event, like a series of events, admitting to the hospital, going through the scans, blood taking, then the PCI procedure. Some patients may feel fear, shock, denial, angry, anxious, depressed because they are adjusting. Most likely they will be thinking, what is next? Why need to take medication every day? How to prevent it from happening again? Why this happened to me? There will be a lot of things going through their mind. So please give some time to yourself to rest, readjust back to your normal lifestyle. So please join the cardiac rehab program so they can guide you through it. Okay, so for sexual activities, avoid sexual activities for the next 1 to 2 weeks. You may resume the activities if you can climb 2 flights of stairs at a fair brisk pace without feeling breathless or experiencing any chest discomfort. It is normal to feel anxious or worried that your heart condition will be triggered by the activity. So it is important to take time to get comfortable with your partner again. Please avoid sexual activities immediately after meals. Wait for 2 hours. After drinking alcohol, smoking, or if you feel tired as well. Also, change position that put less pressure or stress on your chest. Drugs like Viagra, may cause side effect with your heart medication. So please consult your cardiologist before using it. Driving. You are able to drive again if you are recovering well from your heart attack. So there is different time frame to returning to driving depending on what type of heart condition you have. For more information, you can refer to the website Singapore Medical Association for the specific time frame. Last but not least, holiday is very important to us. So traveling abroad is not recommended for 2 weeks, at least 2 weeks or to 1 month after discharge. Please consult your cardiologist with regards to traveling. So if you are able to travel, please bring your medication list and extra week of medication supply. With that also, you will need to go for your follow-up with doctor after discharge. Okay, so next we will be talking about the risk factors of CAD and how to reduce the risk. These risk factors listed on these slides are quite common to us. Who knows, some of us may have it or our family members may have it, especially the last point, stress, which we will go through it every day in school, at work, during an exam, even during a meeting presentation. So let's tackle it and manage it instead. For smokers, they are almost twice as likely to have a CAD in comparison to a non-smoker, as smoking damages the lining of the arteries that will lead to building up of the fatty deposit, causing blood clots to form easily. To add on, nicotine in the cigarettes causes your body to produce more adrenaline, making your heart beat faster and raising your blood pressure. Hyperlipidemia, which is also known as our high cholesterol. Cholesterol builds new cells, insulate nerves, and produce hormones. Cholesterol is produced by the liver and from what we eat. When there is too much cholesterol in the blood, it stays in the wall of your arteries, causing them to be hard and narrow. So you guys would probably know there are two types of cholesterol, the good and the bad cholesterol. The higher your LDL, which is your bad cholesterol, the higher risk of CAD as shown in this diagram. So on the other hand, HDL is a good cholesterol that will reduce the cholesterol from the blood. Obesity. Being obese can raise blood cholesterol and triglyceride, which is a type of fat, increasing the blood pressure and leading to diabetes. Therefore, we should aim to maintain an ideal body weight of BMI 18.5 to 22.9 kg/m square. Hypertension, which is also known as our high blood pressure, the extra force on the blood vessel can damage the cell of the blood vessel inner lining. The cholesterol in the bloodstream can build up in the damaged arteries. Over time, the vessel walls will be less elastic, slowing down blood flow. This will then increase the risk of getting CAD. Diabetes, high blood sugar, it can damage our blood vessels and nerves that control your heart and blood vessel. The longer you have diabetes, the higher chance of developing heart disease. The lining of the blood vessel may become thicker, which then slows down the blood flow. Physical inactivity can seriously affect your health. It increases the chance of developing all those that I've mentioned, overall increasing the risk of CAD. Stress. Last but not least is stress. We handle stress every day. Sometimes we can manage, sometimes we cannot. Sometimes our friends, our family is there to help us. But if we can't manage the stress, leading to emotional, psychological, even physically when we are stressed, our behavior also will be affected. We could be shouting, venting out, crying, binge eating, drinking alcohol, smoking. They feel that this is how they can manage their stress, which is very unhealthy. There are studies showing that stress can change the way blood clots. So when we feel stressed or we feel anxious, right, we will actually feel our heart beating very fast. Yeah, our blood pressure will go up also. So stronger contraction of the heart muscles in the long run can damage the wall lining of the heart. So how do we tackle all these common risk factors that ourselves may be going through? So we will need to have a behavioral change. For smokers, we need to quit smoking. We need to know the benefit of quitting smoking. So the benefit would be reducing the risk of CAD, risk of developing cancer and lung diseases. It will also help to improve blood circulation, prevent complication that leads to gangrene or amputation. Later, I'll explain in the next slide. Breathe in fresh air, improving your stamina, regaining your taste buds and enjoying food. And also, of course, to save the cost of buying the cigarettes. So this is the gangrene photo. It is a type of tissue death caused by lack of blood supply or serious bacterial infection, commonly affecting the arms, legs, toes, and fingers. It can also occur in a muscle and in organs inside the body, such as gallbladder. A condition that damage the blood vessel and affect the blood flow, such as diabetes or hardened arteries, increase the risk of gangrene. So firstly, the smokers here, you need to quit smoking. I know it's very easy to say, but may not be easy to do. So you will need to take the first step to gradually reduce your number of cigarettes. Then we need to go through cold turkey. We need to set a particular date to stop smoking and stand firm. You could also seek professional help. There is a referral to our smoking cessation team. They can recommend you, they will support you and advise you, and maybe prescribe you. They will want to give you nicotine patch or gums to curb your smoking. They will even call you to follow up on your progression at home or outside lah. Okay, so with that, we also, for food wise, we need to adopt a healthy, well-balanced diet by increasing our fiber intake from vegetables and fruits, limiting our intake of refined sugars from food like desserts and cakes, and also choose healthier fats and oil, using it as little as possible when you cook. Okay, so how we increase our fiber intake? It helps to reduce cholesterol. We can aim to have 2 servings of fruits and vegetables daily. Choose whole grains such as oats or brown rice, as shown in this photo, very colorful. This photo diagram shows the food high in fiber lah. So you all can see have the recommendation. Okay. So secondly, we need to limit our refined sugar. This photo very nice. A lot of tempting food. We need to reduce it. Reduce and limit the intake of it, such as also including soft drink, bubble tea. Choose sugar-free beverage whenever possible. Opt for less sweet. I think government also will implementing healthier choice symbol recommendation for us to get it instead lah. So we can choose. We also can choose healthier fats and oil. We can use olive oil, canola oil, plant oil. Our cooking technique also can be healthier, like steaming, boiling, baking, grilling, stir frying, and stewing. We need to limit our deep frying to once a week. Remove the visible fats and skin from poultry, such as chicken. Actually, fish also can, fish skin as well. Yeah, so choose plain rice, brown rice over nasi lemak, chicken rice, or fried rice. If you need any personalized dietary advice, we also have our dietitian to help you with this. So for stress, get enough sleep, 7 to 8 hours. Secondly, we exercise. Thirdly, we should have positive thinking. It will help you to maintain sense of control and confidence to tackle the challenge you're facing. Fourthly, find someone you can confide in, share your feelings, and you'll be able to feel supported by them. It can be your close ones or friends lah. Okay, then also please have your me time. Engage in something you enjoy and relax. An example like watching a show that will improve your mood. Then of course everyone would want to plan for a vacation. So taking a break from your usual routine to feel refreshed and restore confidence to handle challenges. Do not run away from your problems. Resolve it. This will help maintain a healthy level of stress as well. So with this, our hospital also have a service, psychologist service if you still cannot handle your stress. Okay. So next. So next we'll be talking about our cardiac rehab exercising. Okay, so for exercising, coronary arteries will become wider and more flexible, therefore decreasing the risk of developing high blood pressure. Muscle will contract and cells are able to take up glucose and use it as energy, therefore reducing the blood glucose level. Enzymes will be able to move the bad cholesterol, LDL, from the blood to the liver, where the liver can convert it to bile to remove. So it's like the more you exercise, the more bad cholesterol will be removed. And then we will feel, and then anxiety and depressing moments, stress level will be reduced as well. Your energy, your mood, your sleep, your general sense of well-being will also be improved. But of course, because you have just suffered a heart event, we need to exercise safely. So this will go on to my next slide on cardiac rehab program. So cardiac rehab program is a multidisciplinary disciplinary treatment and secondary prevention program for patients after a heart attack and angioplasty. The purpose of the program is to help the patient roads of recovery and prevent further heart problem. This program consists of two main parts. Firstly is the education and counseling. It will help you understand your heart condition better and find ways to reduce your risk of future heart problem. Secondly, exercise training and prescription. Physiotherapists will be able to assess safety based on your ability and needs. Regular exercise training according to FIIT, frequency, intensity, type, and time will improve cardio and respiratory fitness and well-being. With that, I have come to the end of the presentation. Thank you, and I hope you have learned something new today. So next slide is the FAQs on for the patient that went through a stent and have some queries for this. Thank you.
Thank you, Sabrina. Okay, so now it's time for the Q&A section. So we have come to the end of the sharing session. So if you have any question, do submit them using the Q&A button below. We will try our best to answer questions that are beneficial for the general public as a whole. Okay, so we are unable to give very specific medical advice for your specific condition. So if you have any questions that are related or very personal, do check them with your healthcare team instead. But if you have a general questions that you think Sabrina or even our brother Hashri here can help to answer, please do use the button, the Q&A button below, and then submit them. Thank you everyone for sending your questions. I see quite a number coming in. So maybe I'll just hand the time over to Sabrina to answer your questions. Yes, Sabrina, please.
Hi. So the question is, once a stent is placed in a heart, it remains there forever. So it is permanent. There is just 2 to 3% risk of narrowing coming back. And if that happens, it is usually 6 to 9 months. If it is thus, it can be potentially be treated with another stent. So there are a few types of stent. The doctors usually use the drug-eluting stent, which is they will release medication to reduce the new clot from forming. asking why heart medicines cannot be together with their traditional medicines, Chinese medicine. So there will be interaction between both of them, which can result in unwanted effects, such as reducing the body absorption of the one of the medication. That means it may not be as effective. Yeah. Okay, so another question is there a CAD support group in Singapore, like a sharing group that comes together? So there is a support group in NUH. It is called a Caring Heart Support Group, voluntary initiated by the patients from NUH Center, National University Heart Center. Yep. For our side, we have our TTSH cardiac rehab program. This is also, they will support you in all this. Another question about the angioplasty. How intensive can a person exercise? 40%, 60% of max heart rate. So for this, when the patient comes back from the procedure, the doctor will actually refer to a physiotherapist. So from there, they will the physio is the one who teach you all what to do lah. So another question about eating eggs will increase cholesterol. So according to the American Heart Association, they actually recommend up to 1 egg a day for most of the people. Hello, so another question is about whether CAD can be reversed. So CAD it happened to you already. So sadly it cannot be reversed, but you can manage and slow down the progression of it. So to slow down the progression, you need to see my recommendation just now. I have spoken. I mentioned with the diet, with the exercising and all to reduce it. Yeah. Okay, so another question. Should we go for yearly treadmill or ECG to check our heart condition before it's too late? So when you all do post PCI, there will be follow up by to see doctor. So doctor will recommend the procedure that you need to go through.
Okay, hi everyone. So give our speakers a moment to answer your questions. There are a lot coming in, so we are trying to group them together to see how we can answer them together. Yeah, so yes, do stay on. Our speakers will address your question shortly.
So hi, sorry for the delay. Yeah. So for Miss Teo, after the stenting procedure, how can we know whether the plaque is accumulating in the area of the artery? So actually the procedure already unclogged, widened the plaque, and there is medication to dilute the clots. So you would, if you feel chest pain, most likely we need to do another angiogram to check whether there is any accumulating plaques there. Yep. Okay, another question. I was prescribed to take 80 mg for my cholesterol, but you're very tired and distressed. So for this, when you go for your follow-up, you can let the doctor know about this so they can check, maybe take another blood test or change another type of cholesterol medicine for you. Yep. Hello, another question. Will stent become smaller in size over time? No. Hello, is coconut oil good for the heart? So it's good to an extent. So please take in moderation as well. Yeah, so the coconut oil also has fats, so please take in moderation. For the question about the artery which has a stent and clot again, must you definitely have a bypass? So basically, when you admit to the hospital, doctor is the one who will do the testings and scan to see how many percent is blocked, how many percent is stenosis. Then they will recommend you whether you need to do a bypass or not. So yeah, it depends. Another question is about medication after angioplasty. A lifelong thing, or can some be stopped after some time? So whenever we receive this type of patient from post procedure, the doctor will write there, example, DAPT for 1 year, or they put aspirin lifelong. So it really depends on what doctor have the order from there lah. Hello, the question for what kind of diet must I follow and exercise? Yeah, so I've mentioned in my slides on what kind of diet. So the diet of high fiber food and less sugar, limit the intake of refined sugar, and also using healthier oil. For the exercise part, right, the physiotherapist will assess accordingly to your needs lah. So we would recommend the physio to advise this. Okay, so there is a question about determining factors of doctors to decide on medicated stent or non-medicated stent, whether which one is preferred. So to our latest cardio forum, they actually recommend the DES stent instead lah, because there's studies that shows that is the drug-eluting stent is more effective. Yep. Hello, for Miss Teo, about the stenting that you had and you want to slow down your blockage, please follow my recommendation for food. Okay, the healthy food, your exercise, also limit your deep fry, limit your sugars, and also please be compliant to your medication. Always go back to follow up with doctor, let doctor know what you are experiencing. They are the one that will give you recommendation now. And also take your blood test to see whether there's improvement and all. Hello, about can anyone join the cardiac rehab program, or is it restricted to those who have undergone angioplasty or bypass? So this one, I need doctor to refer you to the cardiac program lah. So most likely it's customized to the patients that has gone through all the heart events. Yeah. Hello, another question. Is it better to base our food choice on GI or glycemic load, and why? Wow, this question would I think you must ask the doctor to refer to a dietitian for further clearer explanation for this detail. Yeah. So another question, prior to holiday, should one go for a medical checkup? Okay, so for this, right, it depends when you had your heart event. So if you just had your heart event, your traveling abroad is not recommended at least 2 weeks to 1 month after discharge. If you have no heart attack, then with no heart symptoms or what, I think it's okay for you to go for your holiday. Hello. Answering my last question on what are the tests likely to be carried out in tan tock seng to prevent a likelihood of vessel narrowing again. So remember all my risk factors like diabetes, high blood pressure, and also the cholesterol. So all these risk factors must be tested. If it's true blood, then you would know from your fasting bloods, which is your cholesterol bloods, and your blood pressure and your blood sugar. Yeah. Hello. Okay, the last question about the follow-up to the cardiac rehab program. Is it for tan tock seng patient only? Yes, it's for tan tock seng patient only lah. Thank you.
Okay, so now it's almost 3:55. So thank you for all your questions. I hope most of them have been answered. So ending today's health talk, let me just scroll all the way back. Okay. Yeah, so thank you for joining us today. We hope it has been insightful and all your questions have been answered. So before you go, we want to hear from you. On screen, you see right here is actually our feedback QR code. So if you wish to share how you feel about today's talk, please do scan the QR code and share with us your feedback. Alternatively, my colleague will also be sending in the link in the chat below. So you can click on the link and then submit your feedback form. Alternatively, we do have a lot of resources that is on cardiology on our TTSH Health Library. So if you wish to find out more about different heart conditions, do check it out. Currently, there's more than 900 resources, not all on heart, but there are a lot of topics that you can explore. Okay, and then if you want to find out more about our central health talks or what is happening in Tan Tock Seng, you can actually follow our Facebook page or our Instagram right over here. The QR code is also on screen, and then keep up to date on the latest central health activities and events. Okay, so we have come to the end of today's health talk. So thank you everyone for joining us, and we look forward to seeing everybody in the next talk. So for now, have a nice day and goodbye.